hard to see COVID-19 here in the village of Kamatsamo in rural South Africa. On a recent day, most residents weren't diligently wearing masks outdoors, as is the law. But the pandemic is deeply felt here, say residents, who point not to death tolls, but to economic and social devastation.
It's been a problem, like a really problem, a big problem to me.
22-year-old Pakale Sambo wants to become a carpenter and eventually set up her own carpentry shop. But that dream ended when the pandemic arrived.
Because I can't continue with my carpentry studies. I just stopped. And I can't even start my own business because the money is too low. People are complaining they can't even buy these fruits. They're complaining, they say it's too much money, I'm being expensive or something. They say that.
Data about COVID's impact on Africa's urban-rural divide is still being gathered. But one recent study from a group of Nigerian and British researchers warns that rural African communities risk being left behind in the pandemic because of the lack of amenities like good road networks and strong infrastructure like clinics and hospitals. Big efforts such as vaccination campaigns are much more difficult in rural environments, says Freddie Nkosi, country director of an NGO in the Democratic Republic of Congo that focuses on remote, rural, low-income countries.
You need to keep the vaccines in the cold chain environments. And you need to train the people who will transport the vaccines. You need to train the people who will be using the vaccines, the health workers. So getting all these different pieces of puzzles in a very short period of time, that's very, very challenging.
For a town like Kamatsamo, which has 23,000 residents and is less than a day's drive from Johannesburg, that is doable. And for that reason, residents say they prefer to stay here.
It's better to stay in a small place because we have small people there than the big cities, because in the big cities there's a lot of people. Some of them they don't know about COVID, they are stubborn, they don't care about that things.
I think around the rural area is much better than the city because there's not a lot of people. Actually, I think it's safe to be in the rural area.
But Nkosi says his experience in the largest country in sub-Saharan Africa is concerning. What little of it he gets to see.
I traveled in over 5 provinces so far, where I see disparity between what is happening in the urban area or in Kinshasa and what is happening in most of the rural areas, where, for example, if I have to start with the health workers and community health workers, in the rural areas, they have limited access to personal protective equipment compared to those who are in the urban areas.
But rural African life has always been complex and resilient. This town has existed in some form for hundreds of years, through wars, epidemics, and upheavals. This pandemic, in a way, is just a blip in its history. Anita Powell, VOA News, Kamatsamo, South Africa.